A healthy liver should contain little or no fat, though the NHS estimates up to 1 in every 3 people in the UK has early stages of NAFLD, where there are small amounts of fat in their liver. The American Liver Foundation says that if more than 5 to 10% of a liver's weight is fat, then it is called a fatty liver. Having high levels of fat in your liver is associated with an increased risk of other health problems, such as diabetes, high blood pressure and kidney disease. If detected and managed at an early stage, NAFLD can be stopped from getting worse and the amount of fat in your liver can be reduced. Most people will only ever develop the first stage, very often without realizing it. In a small number of cases, it can progress and lead to liver damage if not detected and managed. The Johns Hopkins Medicine (JHM) site notes that fatty liver disease is sometimes called a silent liver disease because it can happen without causing any symptoms. It suggests that most people with NAFLD live with fat in their liver without developing liver damage, though some go on to develop NASH or cirrhosis. NASH is the form of NAFLD in which you have inflammation of the liver and liver damage, in addition to fat in your liver. If liver damage from NASH leads to permanent scarring and hardening of your liver, this is called cirrhosis. JHM says that if you have NASH, you may have symptoms, though it could take years for them to develop. The popular food that quadruples the risk of dying from cancer, warning hypertension diet, the vegetable you should eat every day, advice. The health site suggests that several symptoms from NASH may show up on your skin. This can include yellowing of the skin, spider-like blood vessels on the skin, and long-lasting itching. You may also find that you experience severe tiredness, weakness, and weight loss. It adds, NASH that turns into cirrhosis could cause symptoms like fluid retention, internal bleeding, muscle wasting, and confusion. People with cirrhosis over time may develop liver failure and need a liver transplant. People with a liver condition who develop dark black terry feces, or dark urine, should seek urgent medical attention, according to the British Liver Trust. Other serious symptoms include vomiting blood, bruising easily, itching skin and swelling of the lower tummy area. NAFLD tends to develop in people who are overweight or obese or have diabetes, high cholesterol or high triglycerides. Nonetheless, some people get fatty liver disease without having any pre-existing conditions. People are more likely to develop NAFLD as a result of a number of factors. For example, if you are insulin resistant, as people can be when they have polycystic ovary syndrome. Things like losing weight, eating healthily and regular exercise can help. NAFLD is not caused by alcohol, but drinking may make it worse. Therefore, you may need to cut it out of your diet, or reduce your intake. There's not currently any medicine that can treat NAFLD, but various medicines can be useful in managing the problems associated with the condition. If you develop severe cirrhosis, stage 4 fatty liver disease, and your liver stops working properly, you may need to be put on a waiting list for a liver transplant.